for disease control. Okay, if you go to the CDC website, see, I think it should be cdc.org or anyway, CDC, Center for Disease Control. You will have all kinds of information here about any disease that you want. Worldwide, it's international, okay? You will have all the information here and you can see anything you want. Like outbreaks, for example, here, outbreak. Like salmonella infection, if you want, you can read it here, you go here. And all the information, how that disease is being transmitted and so on will be. And if you want to write here, a condition, so you can write it here. Okay, so that's CDC. CDC is very important. And the next is what we call OSHA. Okay, what does OSHA stand for? Occupational
Safety.
Yes.
Health
Occupational safety and
health and
administration. Okay. Usually this deals with what we call, especially how you handle blood, body fluids. Okay, and it gives a protocol on pathogen standard. How to handle on this pathogen, that bloodborne pathogen standard. Bloodborne pathogen standard, it gave bloodborne pathogen standard. CLI is the clinical laboratory improvement and amendment act. So this one usually gives quality control for laboratories. This one is the clinical laboratory standard. AMA, American Medical Doctors Association, CMS, Center for Medicare Services, Medicaid, and JC, Joint Commission. So, know at least the top two ones are very important, close to you. So like CDC and OSHA, they gave also on what? On infection control. Okay, I can print out this one for you at the end, okay? Infection control. So there are two kinds of precautions. Precautions means how you take a precautionary measure, okay? That means how you prevent yourself and the other staff from having what? That infection, yes? So what are these? One is a universal precaution, or the other name is standard precaution, okay? One is universal, or the other name is standard. Precautions. Okay, you can highlight here infection control. Can you see here? 1, 2, 3 on the fifth line, page 6, fifth line. Did you get infection control? And on the fourth line is universal precaution. You can see that. Yeah. So we have two kinds of precautions: universal, or the other name is standard. That means for any blood fluid that you handle, you need to use what? Gloves. And you need to throw, your needle, okay, intact. It means if you have the safety device, what do? You have to use the safety device to cover your needle, and you have to throw it. Okay, so using gloves for any procedures that you are dealing with blood and body fluids, that is called universal or standard precaution. The other is what we call isolation precaution. Isolation precaution is usually used for patients who are isolated. Let's say they will have what? An isolation room, yes? For those, you need to have more like an isolation care, like it's more than having a glove, okay? You might need to use what? A mask, like your lab or gown or lab coat, okay, cap, glove, and so on. So that is isolation precaution. So there are three kinds according to the kind. We have what we call, do you know these three? One is droplet precautions. The second one is airborne. And the third one, contact. So these three, they are called precaution, isolation precaution. Okay? Okay? Droplet precautions are, for example, like measles, or like flu, or like respiratory infections, some other respiratory infections. Like, for example, you can have also pneumococcal or meningococcal. Pneumococcal, or you know meningitis? Like respiratory infections like pneumococcal or meningococcal. All these are included under droplet precautions. That means if you have a patient with this, then you need to follow what? The droplet precaution. So what do you use for that usually? You need to use what? A mask. So in this case you need a mask. So for droplet infection. Airborne is like tuberculosis. You know tuberculosis? Yeah, it's a bacterial infection caused by a bacterium called Mycobacterium tuberculosis or Mycobacterium tuberculosis. So for this one, what do you need to use? It's called respirator. Respirator. You can use also mask, but there is really to be like more. Respirator is like this. So we have like N95 respirator. That's the one N95 respirator. Let me show you. Respirator is like this. You know, usually they have like here they protect from any dust or particulate or any germs. Okay, it will protect and it will trap in this area. This is N95, and the other one is also called N99. I mean they are the same kinds, but just N99 respirator. So we have N95 and they're basically the same kind. But okay. So these are called respirators. So you use for airborne. So for contact means, let's say if someone has an infection on the skin or like herpes zoster or any kind of infection, then you can use contact precaution. So what do you do in this case? You need to have what? Gloves, and you need to have also like a gown or a like, okay? So you need to have that, okay? So that to avoid any contact or prevent that. So let's say if a patient has HIV, which precautions do you use? Huh?
Gloves.
Okay, some say glove, yes. Okay, glove. Huh? Huh? Some say 2 gloves. Let's write it and which other precautions?
Eyeglass?
Huh? 5? Okay, 5 gloves.
Eyeglass.
And eyeglasses.
Not eyeglass.
Me, I will do acrobat and I will go through the window and you'll find me there. Okay. You don't do all this. Just there is no precaution. It's just you do your routine like what you do here. Okay? No 2 gloves, no 5 gloves, no 5 eyelids, okay? No gown, no other thing.
I am patient.
Huh?
If patient is already HIV patient, so if the patient is last stage of AIDS, how long can they survive?
Well, this is out of the topic, but yeah, it depends on how is it. Nowadays their life is being prolonged because of the medications. Because there is nowadays what we call heart medications. Heart, which is called highly active antiretroviral therapy. It's called heart medication. So because most of them they are on this, before you see there used to be no medication, so it was difficult. But now, so there is this medication. Even I heard last time on HIV day, some of the guys, all the HIV has been eradicated from their blood. Okay, now it's not like before. Now it's the time is prolonged. But when there was no medication, it was like very short. Once they develop AIDS, they don't survive too long. Yeah. Okay. So, we need to know on what we call chain of infection. Okay. What's a chain of infection? Chain of infection, let's say you have a reservoir, okay? Let's say Sagara Sakubi, the reservoir, that means she has, let's say, the flu, okay? And then let's say Robin is what?
Okay.
Okay? And then let's say she is what? The susceptible host. It's called susceptible. Susceptible host means those with low immunity so that they can acquire the disease. Like kids, children, pregnant, some with diseases, okay? Then, let's say if she has cough, the bacteria or the organism, they should come out from here, yeah? How? With what we call mode of exit. That means, how is the mode of exit? Can you show us a mode of exit? Let's say she might cough, okay? Then the cough, it should transport through the air and go to Robin. Wherever she's hiding, even under the bed or under the chair, it will get her, yes? Yeah, so that is called mode of what? Transportation. That means it's transporting through the air. But sometimes, let's say, your baby has this one in the mouth, and then you will give to the other one, then the other baby will not. So that means the mode of transmission is on this. Okay, so these are called fomites. In that case, they are called fomites. Fomites are the third agents where the organism can be, like for example, your pen is a fomite, your keyboard is a fomite, the restroom is a fomite. You go there and then, okay, the doorknob is what? A fomite. When you sit down here on the chair table, because the HIV will not sit here and then, hey, I'm HIV, okay? Don't sit here. She'll tell you like that? No, you don't see anything. Yeah, so that's a fomite. That means the virus is relaxing the whole night and is waiting for you today. Yeah, hands are what? Fomites. Yeah, because organisms can be here. When you say hand, your wallet, it can be what? A fomite. You know, they did like a culture from the wallet, and they develop it in the culture, and they grow lots of like bacteria. Foams. Yeah. So all of these are fomites. These are called fomites. Okay. So mode of exit, and then mode of transportation, and mode of entry. Then finally, you see, now Sagar is coughing. It transports through the air. It can be airborne or droplets. It goes to, that's the mode of transmission. Then how did it get into the Robin? Also through this, because it came through the air, so it goes here, yes? So the mode of entry is what? The same, nose and mouth will be respiratory system, okay? And then she's a susceptible host. So this is called chain of infection. You see? That's how infection is going through. Yeah? So you remember yesterday we discussed on toxoplasma? Toxoplasmosis for a pregnant woman? Did we discuss yesterday or? No? Okay. Okay, so there is no okay. So what should we do in order to avoid this kind of transmission? What do you do to break this chain? What do you do? Always you need to wash what? Hand. So hand washing is the standard. And another thing, you follow the precautions. It can be universal precaution or isolation precaution or contact precaution if we follow that. So with that you try and follow also what we call cough etiquette. What do you do if you have a cough, or cough etiquette will be what?
What we should do about our area around us.
Yeah,
It has.
Yeah, sometimes you can clean the air if depending on the policy of your how you work. Okay?
Is there some
In
sprays
some
to kill the bacteria?
if it is like especially surgical unit and so on, they call it fumigation. Fumigation means they fumigate the air, spray everything, and they close the door and they leave it for one day. Maybe no procedure is done. The other day is clean. Then you clean everything and then you start. It's called fumigation. So it depends on the policy of the how they do. But cleaning, that's your job is to have the office like clean. That's the primary. Then you follow the policy how. Okay. So hand washing, and then you follow the precaution. That's how we break the chain of infection. Okay. Okay. So you can see here how the glove is being removed. Okay. You need to dispose gloves properly. Whatever that you use properly. That means we have sharps, and you have what? The bloodborne pathogen, okay, the biohazard, and then the regular trash. So everything should be disposed of in the proper trash system, and dispose of your PPE. What's PPE? PPE means personal protective equipment. Okay, it means like gloves, like gowns, like masks, like cap or properly fitting shoes, all of these are under personal protective equipment. So you have to dispose them properly and to the right receptacle. That means you follow with that a proper chain of infection. That means how to prevent or avoid that. Okay. How many are you now? I have 10 questions here. 1, 3, 11. Write your name, okay, on the page. And don't see your book, close your books. Okay? Huh? Yeah, if you want, take 1 minute to revise.